on behalf of Human Biologicals Institute and Fearless Against Rabies. Fearless Against Rabies is an initiative by Human Biological Institute to educate about rabies and to reduce the incidence of disease. It is my pleasure to take this opportunity and share about Human Biologicals Institute. Human Biologicals Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health Initiative. One Health Initiative talks about the optimum health of animals, people, and the environment. Indian Immunological Limited was established by National Dairy Development Board (NDDB) in 1982 as its unit and later registered as a company 1999 with the name Indian Immunologicals Limited. Human Biological Institute was established in the year 1998 when the Government of India requested Indian Immunological Limited to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biological Institute was established at Uti. The facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in 2000. Subsequently, Human Biological Institute launched other vaccines and currently we are the major player in human vaccines. We are the leaders in anti-rabies vaccine segment and present in around 60 countries. We are three state-of-the-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, also known as Genome Valley. Human Biological Institute has forayed into the market of clinically proven wellness products and infertility ranges of hormones. Coming to our vision, mission, and values. Our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. Our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are the kind of company who will definitely look after taking care of the environment as well. We proudly bring before you the Green Initiative. As we have launched our flagship brand, anti-rabies vaccine Abhairab, and with this we have taken significant step to reduce the plastic burden by 160 ton per annum. As a company, we don't just manufacture and market products, but Human Biological Institute has done a lot in corporate social responsibility and has taken up various projects. One such project is the adoption of government school. Indian Immunologicals Limited has adopted the two government schools in the vicinity of its Karkapatla facility in Hyderabad. Another program is Gift Milk Program in coordination with National Dairy Development Board. We are giving additional nutritional supplement to over 1600 school-going children of Telangana and Tamil Nadu. We have also facilitated the setup of an oxygen generation plant at Telangana Institute of Medical Sciences, Gachibowli. The unique advantage of this oxygen plant is that it is capable of supplying oxygen to 70 patients at a time. You can visit us on our website www.indieimmune.com. You can also contact us on our toll-free number 1800-313-999977. You can follow us on LinkedIn, YouTube, Facebook, Instagram, and Twitter. You can also go through our unique initiative on fight against rabies at www.fearlessagainstrabies.com and everything you want to know on women health on www.pubertytomenopause.com. So once again, I welcome all our viewers who have joined us live today on Fearless Against Rabies platform. Human Biological Institute is celebrating World Immunization Week, an annual global public health campaign that aims to raise awareness about the importance of vaccine in protecting people from preventable disease. Well, in today's session, we are going to learn about the topic myths and facts on rabies. Rabies is serious public health concern with tens of thousands of deaths occurring worldwide each year. While it is relatively rare in developed countries, it remains a significant threat in many parts of the world. To enlighten us about this topic, we have a very special guest with us today. Please welcome Dr. Bankim K. Modi. It is my great pleasure to introduce Dr. Modi, a highly esteemed senior consultant surgeon at Gandhinagar since 1993. He is a true expert in his field and has gained a reputation as one of the most respected and skilled surgeons in the region. In addition to his work as a surgeon, Dr. Modi has held the position of Associate Professor in the Surgery Department and serves as the President of the Indian Medical Association Gandhinagar branch. His commitment to advancing medical education and promoting the best practices has earned him great respect within the medical community. A very warm welcome, Dr. Bankim K. Modi, on Fearless Against Rabies platform.
Thank you for my nice introduction. Thank you, madam.
Thank you so much, Doctor, for joining us today. Doctor, while we start with our discussion, uh, we all want to know, as well as the audience, can you explain in simple terms that what rabies is and how it can be transmitted to humans?
Rabies is a Latin word. It has been originated from Sanskrit word rabas. Rabas means to do violence. Any person or animal infected from rabies virus, it become panic and mad and to attack some another ones. Rabies is a 100% fatal viral encephalomyelitis. It is known since the ancient 2300 BC, and for the rabies, it is caused by the rabies Lissa virus type 1 virus that belongs to Rhabdoviridia family. And generally, rabies can be transmitted by the bite of any warm-blooded mammalian animal. મીન્સ કે ગરમ રુધિરવાળા સસ્તન આંચળવાળા પ્રાણીના કરડવાથી કોઈ પણ માણસને હડકવા થઈ શકે છે. Rabies can be transmitted by domestic animals like cats and the dogs, and all the peri-domestic animals like cow, buffalo, sheep, goat, camel, and wildlife animal like lion, tiger, leopard, raccoon, bear, and monkeys. They can transmit the virus, and rabies cannot be transmitted by the bite of rodent like rat, rabbit, and squirrel. They cannot transmit the rabies. Okay, madam?
Thank you
And
so much.
rabies can be transmitted by the bite and contact of the legs of the infected animal, and it also can be transmitted by aerosol transmission when person are working in the laboratory where the process for development of various rabies vaccine, in that condition by aerosol transmission rabies can be transmitted, or when the person are traveling the caves harboring vampire bat, and they can be infected by the aerosol infection of the vampire bat, and in rare mode by the method of organ transplantation when person who had died by unknown origin of the neurological death and cornea transplantation to other person, recipient can be infected with the rabies from the original donor.
Okay, thank you so much, Doctor, for making us understand in a very simple terms as well as the elaborative. Doctor, as you mentioned about the categories, so can you explain that what are the categories of animal bite?
Before the explaining the category, why we are giving stress for the rabies. Globally, yearly more than 50,000 death occurs due to rabies. Among that, more than 60%, mean 30,000 death occurs from the India. That is the cause of the concern. And in India, there are 25 million stray dogs population are wandering here and there in search of the food, and they are biting the innocent person and they are become the victim of the rabies. Means 17 million people have to take the post exposure vaccine after bite of the dog. So means every 30 seconds one person is bitten by the dog and they have to take the post exposure vaccine. So that is the cause of the concern. And for the other disease, there is one proverb: prevention is better than cure. But for the rabies, it prevention is the cure because rabies is 100% fatal disease. For the treatment by the bite of animal, Geneva Convention in WHO, they have given guideline for the classification of animal bite wound. They have been categorized in category 1, category 2 and category 3. Category 1 is the simple playing and touching or feeding with the animal. There is contact of saliva of animal on intact skin or covered skin. So there are no minimum risk or no chances of risk of transmission of rabies. For that, category 1, there is no treatment required, no vaccination, no immunoglobulin, just the washing of the local part exposed to the saliva of the animal. So that is the treatment of the category 1. Now category 2, abrasion or nibbling or erosion or abrasion of uncovered skin or wound without bleeding, that is called the category 2. For the category 2, gold standard treatment is the wound treatment, that is the washing of the wound, and on the day 0 we have to start the rabies vaccine, 5 doses of rabies vaccine. There is no requirement of the rabies immunoglobulin. Now category 3. Category 3 is the single or multiple transdermal bite. So in our routine practice, day-to-day practice as a consultant, more than 85% of the cases of animal bite, they should be considered as a category 3, because after any bite of animal there are scratches and abrasion and skin epidermis dermis is broken and bleeding from the wound. So more than 85% wound should be considered as a category 3. Now another type of the category 3, exposure of saliva of infected animal to the mucous membrane. So there is bite on the face, there is exposure of saliva of infected animals to the cornea, either nasal cavity, nostril or the oral cavity. So that is considered as a category 3. For the category 3, we have to start rabies immunoglobulin on the day 0. Along with that, wound treatment, rabies vaccine and tetanus prophylaxis. That is the gold standard treatment. Okay, madam, is there any query?
Yes, yes, but then how would be the management of animal bite?
Management of
Animal bite.
management of animal bite. So there are various myths. People are applying the snuff at home. They are first try for the household remedies. They are giving pressure and applying the snuff over the animal bite wound. And in the rural practice, they are giving balm, they are cauterizing the wound and they are firing the wound. So, and they are applying irritant like chili, turmeric, Colgate, and what not should be applied, they are trying first, and they are ignoring. People are ignoring or neglecting the animal bite cases and the rabies, although it is 100% fatal. But gold standard treatment of animal bite wound. First, we have to wash the wound. Before that, I will go for the structure of the rabies virus. Rabies virus are bullet-shaped, single-stranded, enveloped rabies virus, and they having envelope of lipoprotein, and among that lipoprotein there are various spikes of the G protein and N protein. With the G protein they are creating antigenicity in the host, and with the N protein they are also for the antigenicity production, and with the spikes these viruses move in our body. Rabies virus is neurotropic virus. After the bite, viruses are inoculated in the wound and viruses multiply in the muscle fiber. After the multiplication at the site of the bite, virus will get entry. They will go toward the axons of the peripheral nerve and they will enter into the exoplasm. From peripheral nerve ending, viruses will go to the spinal cord via peripheral nerve to the dorsal root ganglia or posterior horn cells of the spinal cord. Posterior horn cells or dorsal root ganglia are for the sensory, and from that the ascending spinothalamic tract viruses reaches to the brain, and in the brain they will multiply, and from the brain after multiplication, secondary multiplication, viruses are shaded or traveling to the salivary gland, and after that viruses are shaded into the salivary gland and saliva. So viruses are most commonly found in the muscles of the infected person, nerves, brain, salivary gland, saliva and the urine. It is not found in the blood. So till the whole of the process is completed, there is no primary or secondary viremia, means there is no exposure of viruses to the bloodstream, so that there is no acquired immunity for the rabies. Now we will go for the treatment. So after knowing the pathology, viruses are moving in our body with the 1 millimeter per hour with the help of the spikes. And after understanding the pathology or microbiological structure of this rabies virus, we can treat the prevention of the rabies. So first, whenever the animal bite patient comes to your clinic, first you have to wash the wound under running water tap for 10 to 15 minutes. After the washing of wound under running water tap for 10 to 15 minutes, it will mechanical wash all the viruses from the wound. So that is the first step of the rabies prevention. After mechanical washing, you can wash the wound with the detergent antiseptic solution like Savlon. So after the washing with the wound with detergent antiseptic like Savlon, that will inactivate the envelope, fat envelope of the rabies virus. So that is the second method to inactivate the rabies virus. After the washing of the wound with the Savlon, you can wash with the antiseptic like povidone iodine, cetavlon or the alcohol. After that, you can keep the wound open under the sunlight for 10 to 15 minutes. Ultraviolet rays in the sunlight also kills or inactivate the rabies virus. After that, when there is wound, you do not apply the tight dressing over the wound. If necessity arises or bleeding from the wound is continued, you can apply the light protective dressing over the wound and just loose bandaging. There is no role of cauterization. If wound is larger, you cannot heroically suture or tightly suture the wound. When and when there is necessity of suturing arise, you have to just loosely approximation of the wound by just 1 or 2 or 3 suture after giving or infiltrating rabies immunoglobulin inside the wound. If rabies immunoglobulin is not available, you can delay the suturing. You can suture secondarily. So that is the proper method of the treatment of wound, and that is the 80% management for prevention of rabies. That is most important, and we should, as a medical fraternity, we should do awareness of the wound treatment among our patient, our community, and by various organization, non-government organization. By that we can help our vision of Government of India or National Rabies Control Program by making rabies-free India by 2030. So we can prevent and we can save the lives of the human being. Okay, madam?
Thank you so much, doctor, for giving informative answer. As you mentioned about the treatments and anti-immunoglobulins, doctor, can you also explain the injection technique?
Any patient after injury, we just as a protocol giving the tetanus toxoid vaccine. Tetanus toxoid vaccine, when patient is category 3, generally any vaccine should be given over the deltoid region. But when category 3 patient are coming to our clinic, in that patient we are giving TT over the gluteal region, because on one shoulder or two shoulder we have to give the vaccine and we have to give the injection immunoglobulin inside the wound. For the treatment, after wound treatment, we have to start the rabies vaccine. There are various types of the modern tissue culture vaccine. Previously, we were using the nervous tissue vaccine, but various neuroparalytic complication or demyelinating disease complication, WHO and GI has phased out the rabies vaccine since 2009. Nowadays, in our government setup and private sector, we are using various tissue culture vaccine, human diploid cell vaccine. Now all the in market available vaccines are equally safe and the effective. So we can use any vaccine for the prevention of the rabies. So for that, in our government, we have applied two types of the protocol for the prevention of the rabies. For the private setup, one is the SN protocol. For that, we have to understand three types of the method: post exposure, pre exposure, and the re exposure. Whenever we are giving treatment after bite or the exposure of animal, that is called the post exposure method. In private sector, we are giving vaccine by intramuscular route, that is the SN protocol. In SN protocol, we have to give the vaccine on 0, 3, 7, 14 and 28 dose. 8 days. So we have to give the 5 dose of the anti-rabies vaccine for the treatment of the animal bite as a post-exposure prophylaxis. With the cost constraint, government has adopted updated Thai Red Cross regimen by intradermal vaccination. In intradermal vaccination, we have to utilize 1/5 of the intramuscular dose. In intramuscular dose, we have to give the 0.5 ml vaccine whole of the vial. While in intradermal vaccine, we have to give at a single time 0.1 ml of two doses on each deltoid region. So in updated Thai Red Cross regimen, we have to give 0.1 ml dose intradermally over the deltoid region, just 1 inch above the insertion of the deltoid muscle. 0.1 ml dose, each dose on two shoulder at every sitting on day 0, day 3, day 7, and in intradermal regimen we have to skip the day 14 day dose and we directly going on the 28 dose. So intradermal vaccination we are giving the 4 dose. We can give intradermal vaccination to all the patients coming for post-exposure regimen, but we cannot give the intradermal vaccination for the patient who are immunocompromised. For that, we have to give the directly intramuscular regimen. And for intradermal vaccination, DCGI have approved certain vaccination. They are fulfilling the protocol for the intradermal vaccination. Every vaccine should be having potency of 2.5, more than 2.5 international unit. That is the standardized by DCGI and WHO for giving the vaccination by the route of the intradermal or intramuscular route. So that is the post-exposure vaccine for category 2 only. When immunocompromised person or person who are bitten by the wildlife animal, they are, even if category 2 or 3, they should receive rabies immunoglobulin along with the vaccination. Now second type, that is the pre-exposure. Who should receive the pre-exposure? Person who are at the risk of getting the rabies. They have frequent exposure with the animal like veterinary doctor, wildlife officer, zoo officer, person who are engaged with the development and research with the vaccination, person who are traveling the rabies endemic area, they should receive the pre-exposure vaccination. Or doctor who are treating the animal bite cases, they also should receive the pre-exposure vaccination. For the pre-exposure vaccination, we have to give 3 doses of the vaccine on 0, 3 and either 21 or 28 day, because when we are giving the vaccine for the post exposure, we have to give minimum 3 doses or 4 doses within the period of 14 days to faster development of antibody in our to protect the person from the development of the rabies. While in pre-exposure, there are no risk of development of rabies. Just we are preparing our immune system for development of antibody. So slow and sustained antibody development occur after giving the antibody rabies vaccine by day 0, G3 or third dose may be either given on 21 or 28 days. So that is the pre-exposure vaccine. For the re-exposure vaccine, when patient is bitten by previously by animal and they have completed full course of rabies vaccine and documented evidence, when patient is bitten repeatedly within the 3-month period, then there is no requirement of the rabies vaccine. But when patient is bitten by the animal after the 3 months of the completion of the rabies vaccine, then he should receive 2 doses of the rabies vaccine, day 0 and day 3. In this repeat bite, there is no requirement of rabies immunoglobulin. Only 3 doses of the rabies vaccine by intramuscular route. But when you are giving the intradermal route, then 1 dose, 0.1 ml 1 dose on day 0 and day 3. For the same pre-exposure system, when you are giving by intramuscular, you have to give the rabies vaccine, full vaccine day 0, day 3 and day 28 or 21. But when you are using the intradermal vaccination, you have to give the only 0.1 ml single dose on the 3 days 0, 3, either 21 or 28. When patient have previously received vaccine, pre-exposure vaccine, when definitive bite or bite occurs after few days, then there is no requirement of rabies immunoglobulin in that condition, because our immune system have already prime and immune system having the memory for the development of the antibody.
Thank you, doctor, for covering the major part as well as informing about the anti-immunoglobulin as well as the re-exposure and the post-exposure vaccination. Doctor, I want to ask you that, as you mentioned about the post-exposure vaccination, but what is the post-exposure vaccination in immunocompromised patients?
Immunocompromised person, they are considered patient who are suffering from diabetes, HIV, patient who are receiving the chemotherapy, malnourished, tuberculosis, they are considered as immunocompromised. They should receive special attention. So either it may be category 2 bite or category 3 bite, and CD4 count less than 200. They should be given rabies vaccination full dose along with rabies immunoglobulin, and after completion of rabies vaccination, after 15 days or 2 weeks, they should be titrated for virus neutralizing antibody, and that antibody should be more than 0.5 international unit. That antibody titer level will protect the person from development of the rabies.
Thank you, doctor. Doctor, as you again mentioned about the vaccination schedule for the anti-rabies vaccine, I again want to ask you, if a person has been bitten by an animal who is suspected of having rabies, so by that time, what would be the management of vaccination schedule?
Pardon me, repeat, can you repeat the question?
Yes, doctor. So if a person has been bitten by an animal which is suspected of having rabies, so how would be the management of vaccination schedule?
Vaccination management schedule will be the same 0, 3, 7, 14 and 28. If wound is category 3, then we have to give the rabies immunoglobulin on the day 0. Generally, rabid and person who are bitten by the rabid animal, almost all the wounds are the severe and they are the category 3. So that patient should receive rabies vaccine, immunoglobulin and the complete wound treatment.
Thank you, doctor, for answering that question. Doctor, thank you once again for giving us a lot of information on today. It's time to take some questions from our viewers, doctor.
Before that, I want to clarify about the intradermal regimen,
Yes,
how it can
yes,
be given.
yes.
Intradermal regimen, generally government setup are using for the intradermal vaccination. In that condition, staff should be specially trained and vial of the vaccine they are stored at the 2 to 8 degree, and they are for the specially for the intradermal 0.1 ml dose on deltoid region. After giving the intradermal vaccination, that should raise 2 to 4 bleb. If visible bleb is not developed, then we have to give the another repeat dose adjacent to previously given. So that is the method. After reconstituted vial, that should be used within 4 to 6 hours after reconstitution. That is the message for use of the intradermal vaccine. Now I will focus light on the use of the immunoglobulin. Why immunoglobulin is required? After giving 0, 3, 7, 14 days, that is the active immunity system. After giving vaccine, our body will develop antibodies very slowly. But when there is severe exposure, patient require virus neutralizing antibody at the more level. So by conferring giving ready-made antibody by passive immunization by means of the giving rabies immunoglobulin. So rabies immunoglobulin act at the three mode. They will destroy the rabies virus all in the wound, and this rabies immunoglobulin that will causes the coating of the rabies virus, that will prevent the entry of rabies virus into the axons of the peripheral nerve. So that is the method. And another method, after giving rabies immunoglobulin into the wound, the virus neutralizing antibody titer will develop within 24 hours period. So we can protect person within the 24 hours. So we can protect the person in the window period 0 to 14 day by giving rabies and passive immunization with rig. The antibody titer will be rise, that will gradually decline with the development of indigenous antibody by vaccine. So that is the important. There are two types of the rabies immunoglobulin, equine origin and the human origin. For the giving dose, equine rabies immunoglobulin should be given 40 international unit per kg body weight, and all the amount of rabies immunoglobulin should be injected or infiltrated into and around the wound if feasible possible. If wound is situated near the eye or distal part of the finger, that you cannot inject the full amount of the rabies immunoglobulin, because when you are injecting more amount of rabies immunoglobulin, that will causes the compartment syndrome or gangrene of the finger. Or it is near the eye, it is not possible, or in the nose it is not possible. So remaining amount can be given on the opposite deltoid region. When patient have multiple wound and immunoglobulin quantity is less, so you can dilute the rabies immunoglobulin with normal saline up to 2 to 3 times, and you have to inject or infiltrate all the animal bite wound with the help of the rabies immunoglobulin. Before giving the rabies immunoglobulin, we have to give the test dose 0.1 into 10 dilution of the 0.1. That should be given on the forearm. After that, you have to wait for 30 minutes, and if there is no adverse reaction, wheal or flare reaction, urticaria, or no itching or no fall of blood pressure, then you can give the full dose of the rabies immunoglobulin. Thank you, madam. You can ask.
Thank you so much, doctor, for giving us a lot of information, descriptive information on today's topic. Doctor, it's time to take some questions from our viewers.
Okay.
The first question is, if someone has been previously vaccinated against it, you have answered this question, doctor, but I'll again be repeating. If someone has been previously vaccinated against rabies, do they still need to receive treatment if they are bitten by an animal that may have rabies?
If previously vaccinated person documented evidence within the 3 months, then there is no requirement of the vaccination. But after 3 months or patient is apprehensive, then you can give the two dose. There is, because at the risk of the human being life, there is no cost of the vaccine. We can give as a pre-exposure prophylaxis. We are giving 3 dose. So when patient is apprehensive or as a cost of the life, we can give 2 dose when patient is already bitten by the rabid animal. So we can give.
Thank you, doctor. Another question is how effective is the vaccine against rabies?
All the vaccines are effective against the rabies, but failure cases have been developed. When there is patient has taken vaccine at the private setup or rural area, when cold chain has not been maintained, or when actually category 3 bite, in that case we have missed or patient had not, we even doctor have advised for rabies immunoglobulin. Patient had not taken rabies immunoglobulin or rabies immunoglobulin was not available. In that condition, failure of the vaccine or patient may develop rabies. Or certain times, patients are coming late at the hospital. After bite of animal, patients are coming 15 or 20 days late. First, they will going for the badhas for the local buas and local religion person. They will give badhas and duras and they are using household and herbal remedy because illiteracy and lack of awareness of the community. They are trying another methods and they are coming late. In that condition, after giving vaccination, even patient can develop rabies. So that are the fallacy. That are not true fallacy, but false fallacy.
Uh, True, doctor. Thank you, doctor. There's another question. What are the possible side effects of rabies vaccine?
There are no side effect of the vaccine because it is developed by the method. If patient, there are, I give three clues. There is no contraindication for the giving rabies vaccination because it is life saving. Even in pregnancy and lactation, you can give the vaccine. There is equal dose for from pediatric to geriatric. There are no change in the difference of the rabies vaccine. Just only difference in rabies immunoglobulin that should be given by the weightage dose on the ml per weight, and there is all any recipient person of the vaccine, they can enjoy their life. There is no dietary restriction. Patient can do exercise. Just they have to take. If they are receiving steroids, they have to postpone. If they are receiving anti-malarial, they cannot take anti-malarial. Or person should avoid alcohol. These three things we have to keep in mind: steroid, anti-malarial, and alcohol. They should be avoided during the rabies vaccination course.
Thank you, doctor. There's another question from Mr. Suresh Parihar. He's asking that drinking cat water gives rabies.
Drinking,
Cat water gives rabies.
pardon me,
Drinking cat water gives rabies.
drinking cat,
Water, the water which is given to cat, if it is accidentally drunk, so can the person get rabies?
no. But there are various queries for in rural area or rural people. Dogs are biting the buffaloes and cow. After that, they will develop the rabies, and people have consumed the milk of the rabies. They become panic. Whole of the families are coming for the vaccination. But when we have consumed the raw milk, we have to take the rabies vaccine. But when we are using the milk after pasteurization, there are minimum chances of development of the rabies. But person, when animal becomes sick, person have given pills in the mouth and they are opening the mouth. If there is abrasion over the hand and they are having exposure of the saliva of infected animal, then they should receive the post exposure rabies vaccination.
Thank you, doctor. Doctor, another question is from Mr. Akshay. He's asking, is rabies virus enveloped or non-enveloped?
Envelope virus, they having fat envelope. By washing the wound with the help of the soap, that saponification process will kill the fat envelope of the rabies virus. They are single stranded enveloped virus, envelope of the lipoprotein, that is called the fat, that will destroy by saponification. By that we have to by that we can inactivate the rabies virus. So that government is advertising, after any animal bite wound, that wound should be washed with running water and with use of the soap or the shampoo that can inactivate the rabies virus.
Thank you, doctor. There's a question, can I get a rabies vaccine if I am pregnant or breastfeeding?
What?
Can I get rabies vaccine if I am pregnant or breastfeeding?
Yes, yes, no problem. In pregnancy and lactation, we can give the rabies vaccine. There is no contraindication. Even pregnant mother or lactating mother can take rabies vaccine if they have bitten by dog or they are having exposure with the infected saliva.
There is another question from Mr. Kaushik. He's asking, sir, is RIG required for people who have received pre-exposure prophylaxis, and how many doses of intramuscular vaccine required for exposure after 1 year of dog
After
scratch?
exposure of 1 year, we have to give the complete full course of intramuscular vaccine 0, 3, 7, 14 and 28 dose. Because with that advancement of the period, virus neutralizing antibody titer will declining.
Uh, Thank you so much, doctor, for answering all the audience questions. Well, thank you again, doctor. It was a wonderful session on the myths and facts on rabies. I
Thank you, madam, for giving us opportunity for conveying our message. Because as a member of APCRI, Association for Prevention and Control of Rabies in India, it is our moral duty to help our hand for the prevention of rabies in community. Because our government's vision, by first it was vision make India rabies free by 2020, but it was not possible. Now government of India and National Rabies Control Program, they have given vision for making rabies free India, and it is 100% fatal disease. So we, it is our moral duty to create awareness during for in the community for the prevention of rabies. And during World Rabies Day, we are also creating various awareness among the country, as well as World Zoonosis Day, that is the birthday of the Louis Pasteur, 6 July 1885. That was the miracle day. That was the first footprint in the history of rabies. That experimental vaccine by Louis Pasteur he gave to 14-year young boy Joseph Mister. He was the first recipient of the rabies vaccine. Luckily, he was survived, and that was the first footprint in the history of rabies. We all person should pay our respect to legendary French scientist Louis Pasteur, who developed the rabies vaccine.
Yes, sir, true. And doctor, in the end, I want to ask you that what is the most crucial information about the rabies disease that general public should be aware of?
For the general public, rabies is 100% fatal disease. So we should not take any risk or the chance for prevention. All the animal bites patient, they should rush immediately, the either it may be government hospital or private hospital, but they should receive the vaccination first. When the vaccine or government facility is far distal, they should wash the wound immediately. So wound toilet is most important after that vaccine. And if the category 3, the treatment is accomplished or fortified with the use of the human rabies or equine rabies immunoglobulin, and that is the gold standard treatment for the prevention of the rabies.
Thank you, doctor. Thank you so much for giving the crucial information about the rabies. Well, doctor, we wholeheartedly thank you on behalf on my team as well as the Human Biologicals Institute for sparing your most valuable time with us. Uh, and
Thank you, Human Biological. Thank you, Deepali Madam. And thank you, our viewers who have joined today's webinar. And I also request them to spread my message in the community. If any query, you can contact me on my mail also. I have given Dr. Bankim Modi 2806 at the gmail.com.
thank you, doctor. Thank you. And I know, as you said, a lot of people who are watching us are benefited from this wonderful session. I wholeheartedly thanks our viewers as well for being with us in each and every session. You can all follow us on Instagram, Facebook, LinkedIn, and Twitter to get more updates on live talks with experts doctor across the nation. With that, I wish everyone a very good afternoon. Thank you, doctor.
Thank you, madam.
Thank you, doctor.